behalf of the division and the college, I'd like to warmly welcome you to this webinar on transition to residency training in surgery. This is one of the most important transitions that we've all gone through in our careers as surgeons, and certainly as medical students, you are preparing to make this transition. It's one that is associated with many challenges, huge opportunities, and a lot of excitement. What we have for you this evening is a wonderful webinar that includes program directors who will share their perspectives to prepare you better for this transition, and the residents that will share their experiences, which would be closer to where you are, and perhaps will give you some tips as to how to make this transition the most successful one of your careers. I'd like to begin by thanking the presenters, both the program directors as well as the residents. And I would like to begin by recognizing Dr. Stephen Yang, who is the chair of our American College of Surgeons Committee on Medical Student Education. In his day job, he is professor of surgery and oncology at the Johns Hopkins University. He is also an endowed professor of thoracic surgery, a renowned surgeon educator, and a member of the American College of Surgeons Academy of Master Surgeon Educators. He's done a fantastic job as a lead for the committee and with these webinars. And without further ado, I will pass the baton on to Dr. Yang to get the program started. Thank you so much for attending, and I hope you'll enjoy the evening.
Well, thank you, Dr. Sachdev, again for your very kind words and your personal support and engagement with our medical students over 2 decades now. So good evening from Baltimore. As Dr. Sachdeva stated, I'm a thoracic surgeon at Hopkins here, and proud to be chair of this really outstanding committee, which I think is probably the hardest working amongst all of the ACS committees. I want to also thank my colleagues and friends for taking time out of their busy schedules to be with you tonight, and in particular, Dr. Barb Pettit, who had put this program together and will be your main host tonight. Obviously, as Dr. Sachdeva said, it's the most exciting time of your medical school career as it draws to a close with your impending graduation, and maybe a little bit anticlimactic since unfortunately I think it's probably going to be virtual. And for many, after the excitement and celebration has died down after match day last month, reality starts settling in, and perhaps some anxiety about the unknowns of transitioning into residency, about changes in your personal life, finding a new place to live. It's a bit harrowing. So tonight, I hope we can answer many of your questions with our distinguished panel of surgeons who are the who's who in surgical education. We have an outstanding panel of residents handpicked for their excellence as being surgical residents. And so now I'd like to turn it over to Barb Pettit, who has been with this committee for as long as I know, probably 10 years, who's been a very hardworking member. And we also share a very common bond that both of our sons are going into surgery next year. And probably like the typical parents, they're probably not on this webinar tonight, even though they should be.
Mine is not. He's on his way back from the Florida Keys.
I know. Mine just texted me, he says he's got a shift tonight. So anyway, I'd like to introduce Barb Pettit, a well-known surgical educator. She's currently the director of medical student education at Emory University in Atlanta. So Barb, the video is yours.
Yeah, hi everybody. And I was going to add terror to the list of feelings you may be feeling right now as you start your internship in just literally a couple of months. Our panel tonight, our first panel, is some very distinguished program directors. Jennifer Choi is a bariatric and MIS surgeon. She serves as the program director at Indiana University School of Medicine in the general surgery program. One of her primary goals as a program director is to get interns off on the right foot as they start their training. So this panel is particularly meaningful for her. Jake Quick is the Associate Professor and Acute Care Surgeon at the University of Missouri. He is a Program Director of Surgical Critical Care, and he is the Associate Program Director of General Surgery. Jeremy, is Dr. Lippman here with us yet? He will be, there you go. Okay, Dr. Lippman is a colorectal surgeon, and he is Program Director for the General Surgery Residency at the Cleveland Clinic. I will also introduce our understudy tonight. PJ Schnartz is the understudy if anybody happens to drop out suddenly because they have a case, which it might be Dr. Quick. He is currently the Associate Dean for Clinical Affairs at Des Moines University College of Osteopathic Medicine and Professor of Surgical Education at Creighton University. So I'm going to start off with our panel with the first question. What do program directors expect incoming interns to have done to prepare for internship? And somebody wants
I'll
to
start with that.
Okay.
Hi, everybody. So good to see you. I've scanned the list to see if any of my incoming interns are here. So I know you're here and I know if you're not. Just kidding. So I think from my perspective as a program director, there are so many things that that can help you just be settled as soon as you get here. Likely your coordinators have contacted you. And so if they've contacted you to ask for information, to fill out paperwork, to complete licensing paperwork, those things, when they ask for them, are going to be really important to get them done, in a very short period of time, from the standpoint of all of those things that have to happen on the back end for us to get you started going right away. In our program and some other programs, we also use the Fundamentals of Surgery curriculum. For those of you who interviewed with us, I know that the last few months have been relatively non-clinical. And so we utilize the Fundamentals of Surgery curriculum really to help you start thinking clinically as you prepare for July 1st, basically. So we know that doesn't necessarily take the place of patients, but it really gets you started in the right foot to think through patients, how you'll manage them. And so whenever we send you the list of modules, it looks really long, but those modules are all very doable. I don't know how many programs utilize those, but that is one of the features of our program that will help you get ready for July 1st.
Yeah, we also use the Fundamentals of Surgery curriculum and really like it. And certainly I would encourage everyone to use this time as an opportunity to be a little bit introspective about where are the gaps in your knowledge, or what are the things that you really want to learn. This is like the greatest time to be a medical student, not the COVID time, but the end of your last clinical year, where you can do any elective you want, any rotation, and just do it for the sheer joy of learning and filling in gaps in your understanding. And your grades could not matter less as long as you do the minimum requirements. So I would encourage you to do that.
I'll add something real quick to that. I always tell people to read On-Call Surgery. It's just basic stuff that you're going to have to deal with as an intern, especially if you're on call at night or you start out on a night float thing. Reading that On-Call Surgery will help get you through those first few weeks, because really after those first couple of weeks, that rockiness kind of goes away and you're right in the swing of things and you're just rolling. It's just that first few weeks where everybody's just a little bit tense, and knowing those simple things like how to work up low urine output, very simple, basic things that you have to do as a doctor, that will help a lot.
I will add one more thing, and that's to go on a nice vacation. Even in COVID times, you can still take a nice vacation. So I would definitely encourage you doing that.
Okay. Before internship begins, are there any red flag behaviors that an intern might exhibit that would make you worry as they come into your internship?
I'll start with that one. One thing is trying to dictate a schedule can be pretty difficult. you know, a lot of these programs that you're going to go to, there's going to be maybe 30 or 40 interns from a wide variety of services. And there's a very set specific algorithm that everybody follows to try to make sure that the interns, the 2s, 3s, 4s, 5s all have the same experience and the appropriate amount of experience. So you're not always going to get to do, say, if you're following Dr. Yang's footsteps, you're not going to get to do maybe 3 months of cardiac as an intern, right? You might get 1 month of that because that is kind of how it's preset so that you have the experience that you need. So dictating schedules is probably not a great idea.
Yeah, I think along those lines, it's important to look at the year as a marathon. And by the end of the year, you will accomplish all the things that you want to. You will get all the training that you need. Things may not be in the order you were hoping for or were expecting, but it's going to be fine. You are not, well, except in rare cases, you are not the first intern class coming through. So most of the programs are ready for you. We know what's going on. It's going to be great.
PJ, would you like to say something? Usually I hate to see you being so quiet because usually you're not the quiet one in the.
I have lots to say. No, I mean, I would agree with everything that's been said. I would say, I forget who said it, take a vacation. It's important that you're rested before you come. And I would also say, as you approach graduation, to be sure to thank the people who were on this journey with you, because they've sustained you this far, and the next 5 years are tough too. And, you know, make sure you say thank you so they sustain you in the future. But no, Jacob, Jen, and Jeremy, the triple J are right on target.
Okay. On-Call Surgery, by the way, is a great book. I recommend it to my M4s. It's written in the manner in which you would see a patient while you're on call, starting with, you know, the phone call that you get from the nurse and what to think about, and then going right on to elevator thoughts and such like that. It's a great book. For those students whose programs do not use fundamentals, is there some way that they can get access to that? How do they get access to that? And we might want to ask one of our ACS people.
Dr. Pettit, I can chime in about that. ACS Fundamentals of Surgery Curriculum is a program that is offered to program directors to purchase for their incoming residents. It is available now because we want MS4s to have the chance to work on that before they hit the door at the start of their first, at their PGY 1 year. And then it is available through the end of March each year. So we heavily market to our program directors, our general surgery program directors. And I'm, of course, heartened to hear Dr. Choi and Dr. Lippman comment so favorably about that. But unfortunately, it is not available on an individual basis. It is purchased only by the program director for his or her complement of residents.
One thing that would be available, however, is the medical student curriculum. There is a medical student curriculum on the American College of Surgeons website that you do have access to. So if you want to start reviewing things, the common things in surgery, those of you going into general surgery and the general surgery specialties, the medical student curriculum is available. It covers all of the basic stuff in general surgery, well worth reviewing before you come to your internship. And many of the modules that you will read have questions after them if you're into that sort of thing. But that's another resource that you can get for free. Any other comments before we go to the Q&A?
Can I add something to that, Barb?
Sure.
One thing about it is that wherever you are headed, you might want to find out if there are some practice management guidelines, either from different divisions, or if there are departmental practice management guidelines and those kinds of things. You'll find those in a lot of the bigger programs for sure. And get those books, because that's how the faculty will be doing their job. That's how they're going to work up things. That's what they're expecting. And if you know it already, you're going to look like a rock star in those first few weeks when you get asked a question and you just rattle it off, because the person who asked you that question probably wrote the guideline. And that will really kind of help, I think, catapult you.
Who did they get that from, Jake?
It depends on where they go. If you're coming here, you ask me for it. But aside from that, I know Kentucky has some. I would imagine that there are some in Indiana. There's probably some at Cleveland Clinic. You two kind of speak to that, I'm sure.
Yeah, I think for us, a lot of those we would give you when you come onto the service in particular. So I will admit, from my perspective, there are not a lot of things that you can do in a negative or positive way right off the bat. I think everyone has a pretty significant adjustment period. So for the most part, everyone is very, high functioning. You're all the cream of the crop of your medical school, but the transition is hard. And so hopefully you can allow yourself some grace as you make that transition. You're oftentimes moving to a new city. You're oftentimes moving to a new home, even if you're in the same city. You're getting a new job, even if it's in the same institution and you think you know everyone. Your role is totally different. So know that you can come in with confidence, and we appreciate that. But we also recognize that everyone is new, and we will treat everyone as though they are new, because I think that everyone needs to have that soft start. And so enjoy those few moments of the soft start as you can, in order to get your feet wet. Plan to be heavily supervised, even if you don't think you need to be well supervised, you definitely do. So we will provide all of those things for you as you start.
Okay, I have another question. What is the ERRA? Entering Resident Readiness Assessment. And how do program directors use that? And does every program director use it? Do you all use it? What is it?
It's another ACS product, really well designed. I believe some other people on this call might have been involved with that, Dr. Pettit. So we do use it. I believe Dr. Choi uses it as well. In fact, I know she does, because she encouraged me to use it. And it's a great way to get a sense for where the individuals in each class are with sort of some core aspects of medical knowledge, but also as a class to figure out how everyone is doing, and if there's some common areas that need a little extra attention, or maybe that the class is especially skilled in. And for us, at least, we use it to help to shape our first few weeks of new resident didactic sessions.
Dr. Choi, you want to comment?
Yes, we use ours in a similar way. So taking the ERA will be one of the first things you do in our orientation. We use this just to really get a sense of where people are. It is very much a formative assessment, meaning we're not going to measure your whole performance based on this exam. So no need to overly stress about it, for sure. The report comes back and it will just be very honest. This is something you know well. This is something that we need to work on. And similar to Dr. Littman, we utilize this to help drive some of our orientation after we get the results of that. Also, one of the things I really like is it helps the individual resident make a learning plan and helps them understand how to make a learning plan. So I think that one of the benefits of the exam is really in the reporting structure and the processes that happen afterwards, so that they can help. So basically the resident can also be really engaged in their own development in that way. So I really think that the exam is additive for our program. So
I will tell you, students. It is not an MCQ. It is not another board exam. And it's not really anything that you can study for, in the sense that there's a set of, there's a curriculum for it, and there's a question bank and that sort of thing. It's a very different kind of exam. Lots of short answers, testing you on things you're likely to be you're likely to encounter, for instance, when you're on call at night. And so it is an assessment rather than an exam where you get a grade and somehow that's gonna, it really is intended to help you identify where you are weakest in your knowledge and where you're really strong, and help you, like Dr. Choi said, help you set up a learning plan for your own education right off the bat. Yeah. So, let's see here. Dr. Yang, you've been keeping track of the Q&A. Are there any questions that we can answer from the students who are on the webinar?
Yeah, there's some great questions. Before I move on to that, since you brought up a point about questions and stuff, what about maybe just putting a bug in everybody's ears about the in-training exam and cramming at the last second? How should they start preparing for it, other than the
maybe somebody could talk a little bit about what an in-training exam is. What is that? How often do you take it? Any of the program directors want to field that one?
So it's an annual exam taken at the end of January. So it's kind of the midpoint of that first year. You'll take it all 5 years. And it covers a breadth of general surgery. So that's what it is. Really not much more than that, I think. I think what I see residents doing is at about the second week of January, they say, oh, I got to study for the ABSCITE. Well, it's not really a great way of going about it, right? I mean, that's kind of, you'll continue to grow cumulative knowledge throughout that whole time that you're a resident. And your scores will reflect that as well, because it's a percentile rank on how your scores do. But you should just start studying from day one and continue to study throughout the whole year. I mean, that's the same advice I think we'd give anybody in medical school for anything, right? That you continue to study the whole time, that cramming doesn't work. This is a career and a lifestyle choice, and it's what you've got to be good at, and you've got to know it so that you're good at your job, not just so you can pass an exam. And I think if you kind of approach it that way, it's a lot easier to study, and then you don't end up cramming for it. Different programs use the ABSCITE for different things. We use it to just kind of judge your medical knowledge. We don't typically use it as a punitive thing. If you don't do well, you do get your name on a plaque if you do very well. But otherwise, we don't use that for advancement or anything else. It's just kind of a milieu that goes into your entire evaluation.
Okay, great. A couple questions sort of focus on, what makes a good intern, and maybe as a corollary to that, if you are a preliminary intern, how can you, what can you do to make yourself shine, to, perhaps get offered a categorical or even, get a categorical position outside their institution?
I think, all the interns want to shine, and you're all going on to these residency programs. General surgery has become so competitive that to get there, you are all the top of your classes and have had so many successes, and you just want that to continue. I think it's a big mind shift, though, from in medical school, when it's all about the grades and getting honors and getting this thing and that thing, to now it's about being a great doctor and providing excellent patient care and being a strong member of your team. So those are the things that are going to get you to succeed. So like Dr. Quick said, the reading. It's very evident who is reading and preparing for cases and
Okay,
He froze.
Dr. Lippman.
yeah, Dr. Lippman is frozen. So if somebody wants to pick up on that, maybe Dr. Quick or, oh wait, there you go. You were frozen, Jeremy, for a sec. So it's very evident who is reading is kind of where we lost you. Uh-oh, we
I
lost.
think you may be refrozen. But,
Yeah.
but I'll echo, I think the main thing is we don't want to create an environment of competition, but everyone wants to really encourage and propel their classmates to be their best. And so remembering that you're preparing to be a surgeon ultimately, and working hard to accomplish those things, reading, practicing the skills lab, being prepared for cases, taking good care of your patients on the floor. Those are all good things that are going to get you recognized.
Okay.
I'm sorry if I cut out.
I don't know if you want to finish up your question, your answer.
Just imagine it as whatever genius thing that you were hoping I would say, and that's pretty much what I said. What I was going to say is just it's a transition from focusing on grades and evaluation and whatnot to being a great doctor, and encouraging everyone to follow Dr. Quick's advice of reading and preparing for the cases you're seeing in the operating room, in the clinic, on the floor. Those patients become the way that you remember these things, and the operations are less about what you've read, and it becomes more about, oh yeah, I remember on Mrs. Smith we did this and that worked, and that's how I do the operation. And watching her recovery, and that's how you learn. I think one of the things that a common mistake that I see is people getting distracted by wanting to do everything at once, wanting to have publications right off the bat and joining this committee and that thing and whatever. I really encourage people to just focus very much on being a great clinician first, and then letting the other stuff come later once you have that routine established.
So another similar clinical question on their performance is in the first 6 months, how much do interns want to think for themselves for post-op management on floor work? And how much do you want interns to ask their senior residents for help?
From my perspective, I think in the first month, you should really ask your senior for almost everything, because there is going to be some institutional variation in how things are done. So I would suggest that that the senior be involved in almost every decision, if not before you make it, immediately after. So certainly come with your plans and saying, the patient's pain is not well controlled. This is what I would propose to do. And they say yes or no, basically. So I think that early on, I think a lot of those things need to be run through a senior resident. And then after that, you'll recognize when the leash can get a little bit longer. So the ACGME also requires us to provide supervision, direct supervision, which means someone seeing the patient with you, essentially helping you make the decision at the elbow for certain serious things. So things like shortness of breath, chest pain, arrhythmias, hypotension, mental status changes. So until we can verify that you're competent to manage those patients independently, really you should have a senior resident or staff or experienced APP at your elbow when you're evaluating those patients.
I think there's a lot of value in setting the expectation with your senior residents. How do they want you to get in touch with them and follow up? But a nice default is just planning to check in with them at some routine time period throughout the day. You may be off very busy and thinking that you're getting everything done. If they're not hearing from you, they don't know what's going on. And you may be going down pathways you don't want to be. So I would just set up routine check-ins throughout the day, let them know what you're doing, make sure you're on the right path, and let them, like Dr. Choi said, let them lengthen the leash as you become ready for it.
And when you go check in, go to the operating room and talk to them. It'll do a couple different things. One, it gets you to the operating room, so you're more likely to scrub in and do those cases if you're managing the floor. Two, it lets everybody learn who you are, because especially in larger programs, it takes a little while to kind of get to know who everyone is. So go to the operating room, talk to your chief, talk to your seniors, talk to your faculty, and most likely you're going to get to scrub and do some stuff.
Sort of along the same lines, because of the work, a question is, how do you improve your efficiency in the floor work so that you can get to the OR as much as you can?
All right, Dr. Yang, maybe one more. We're at 8:30 and I want to get to the resident panel because I know there's going to be a lot of questions for that. Do you have one more question we can field here real quick?
Let's see, are there any, is there anything that you would suggest in preparing them from technical skills such as laparoscopic skills, suturing, et cetera, that you would recommend?
So most places have some skills labs available. Further, there are many like Ethicon in particular, and perhaps even some of the other companies can provide with FLS practice kits. So those are all good resources. So I think FLS is a great way to practice your laparoscopic skills. And the last thing I'll say is just get to the operating room, and the more you're there, the more you're going to have a chance to utilize the instrumentation and get advice from the faculty. So take advantage of your skills labs, practice at home, and go to the operating room.
Okay.
Actually, no.
Yeah, you want one more?
I thought we had 15 more minutes.
Oh, okay. Yes, we do. Yes, we do. Okay.
Another good question is about how do you integrate research, professional development, and mentorship, sort of in general for your residency experience?
Yeah, I think, as I mentioned earlier, I definitely encourage our residents to take the first, ideally 6 months, to just work on becoming a great clinician, getting those skills solidified. You had asked before about how do you become more efficient? You become more efficient by learning routines, watching what other efficient residents are doing, and learning new tips and tricks, and sometimes having a day where you're hugely inefficient and recognizing, okay, that approach did not work for me. I'm going to try something different tomorrow. So I think that takes probably about 6 months, and then following that is the time to start talking to the more senior residents about opportunities for professional development, research, and whatnot, and start looking at those opportunities that are around your program.
Okay. Another question. What do you do as program directors when there's trouble on the team, when somebody's having trouble? How does that work?
That kind of depends on what the trouble is. I'm guessing that when you're saying somebody's having trouble, maybe they're a little bit behind or something like that.
Mm-hmm.
So I think you really have to take an individual approach to helping that person, right? Whatever that is. Say maybe their scores are really low, or they have a tough time taking tests or something like that. Then you've got to individualize that training, right? That might include a weekly meeting to discuss what the reading assignment, quote, assignment was for the week, and have a good discussion about that particular topic. I've done that before, or we've done multiple sample app site questions, that kind of thing. If it's a technical issue, then we'll also do weekly or bi-weekly meetings where we're working on very specific things to improve people's technical ability. And I think that one thing that's a lot different with residency than it is in medical school is that medical school you're pretty easily relegated to just being a number, right? You're just kind of a person in this huge class. Residencies, even huge residencies, are really small. So it's very much what that particular person needs to move forward and what they need to succeed, and not necessarily what all the residents need to succeed, because everyone will have varying levels of knowledge. They're going to have varying levels of technical skill, and that kind of thing. And you've got to get everybody to where they're all very good. And that means working on specific pieces for each person.
Dr. Choi?
I agree with a lot of what Jake said as far as making sure we have an individualized approach. Sometimes there's a personality challenge that we would deal with differently than a medical knowledge challenge or a technical challenge. So I think that it's important for residents to be self-aware and be willing to take the feedback. If we're concerned, not to take offense to that, it's just really trying to make sure that we get you on track and keep you on track. And so sometimes I think none of us, including faculty, take constructive feedback particularly well. And so I think one of the skills that all of our programs are trying to work on is developing a culture of feedback, so we can all learn how to accept constructive feedback better, including the faculty and including the residents. So I think that if we have a concern, maybe just listen and really just kind of try to take it in stride and recognize that we're trying to help you. So
a couple questions about step 3. When do residents take it?
Not early enough usually. I would encourage everyone to get it done as early as you can. As exciting as vaccine schedules are and stages of labor, you may want to push that stuff out of your mind and start thinking about some more relevant topics.
Indeed. Yeah, it is a get it done as quickly as you can. Because what you really want to be studying for over the long haul is, like Dr. Lippman said, being a doctor and being a good surgeon and reading up on your patients. And so the longer you put off step 3, the more you're studying things that probably aren't real relevant to what you're doing.
I guess the ABSITES exam's sort of getting a little bit of eyebrows raised. So how's it scored? Is the curve compared to interns, and is it across the US, across the same institution? So what do those numbers mean when the scores come back?
So I did. So hopefully I'm typing some answers to try to save us a little bit. But the ABSITE is reported in % correct. As an intern, likely you will have never taken a test where you see 48% correct or 52% correct, and that's actually scored well percentile wise. But this might happen. So be prepared to take an exam that you only have a clue on half the answers, and that's normal. So you'll get a % correct, but then you'll get a percentile that's measured across PGY1s nationally. So you will be compared in your percentile range to PGY1s across the country, PGY2s compared to PGY2s. Now, there are research residents that either go out as a PGY2 or as a PGY3. Research residents are counted with their previous clinical year. So PGY2s will have a mix of research residents in there, as will PGY3s. So that's just something to keep in the back of your mind if you go straight through. So.
Interesting question. So the tables are being turned now. So the medical students are going to become the teachers. So any advice on how you teach medical students while taking care of patients, and what are level appropriate tasks that can be delegated to them? Them being medical students now.
I think the most effective thing is to just try to remain mindful of where you are right now and where you were last year. What made a great teacher? Who were the residents that you really enjoyed working with and really valued? And everyone was talking about, oh, this is the one you want to work with. What made them so great? And try to emulate them. I think that's what most of us do. Again, you need to be focusing on your clinical work, but there's always things that you can ask your medical students to help with. I think one of the most underutilized things is if there's a topic that you want to learn more about, your student's going to be very eager to go home and read about it and come up with something relevant and bring you back a summary. It's a great way to keep them engaged and to help you learn something as well.
Don't be afraid to be, I'll just pop in here because I just got through teaching our residents as teachers module for our 4th year students. Don't be afraid to be their coach. Unfortunately, you're very, very close to them in age. So it feels a little weird when you're an intern and a junior resident, even sometimes when you're a junior faculty member. Some of your medical students are older than you are. And that chronologic age belies the fact that a professional age is what we're talking about here. You are older than your students in terms of your professional age. And it is okay for you to say at the beginning of a rotation with your students what you expect of them. And I recommend that you really get into the sort of the coaching mentality with the students. What do you want them to do? And, at the beginning, if you're on a rotation for a while, have a 1-page thing or some notes in your phone that you transfer to them about how many patients they should see, when they should come in, what they should be presenting on rounds, what you expect them to be doing during the day. You get to say these things now, and your students will be very appreciative if you make your expectations very, very clear. And it's one of the things that I think residents don't do as well as they could, is making expectations really clear because you're afraid of, the students not liking you or something. The students will like you a lot better if they know exactly what you want.
So maybe just to finish up this section, probably a very appropriate question, given the topic of our webinar tonight, is what advice do you offer interns who have thoughts of not feeling ready, feeling unprepared, or having the imposter syndrome?
I think it's important to remember that it's not like you're starting a job in which there is no one around, right? You're not going to walk into the hospital and you're going to be the only person there to take care of that patient, right? It's good to think along those lines because it kind of turns your brain on and makes you think deeper into the problem. But you're going to have a lot of support, right? Everyone knows that it's your first day as being a doctor. Everybody knows that, and everybody's ready to help you do it. It's also important to realize too that you didn't get where you are because you're a bad student or because you didn't know anything or because you scored poorly on exams, right? You got where you are because you did a good job and you worked hard, and there's a lot of people there that are helping you get through this pretty rough time. And really after the first few weeks, it'll be like old hat. You guys will just be running right along.
Okay, good. Well, I want to thank all of you, Dr. Choi, Dr. Quick, and then Dr. Lippman, Dr. Yang, for fielding the questions. I hope the students, if you have any more questions, we might be able to get them answered in the next Q&A section, but we're going to go on now to our intern and our resident panel. We have 3 residents for you. Zaina Alatar is from the University of Arizona, Phoenix. She is a PGY1. Alexander Schulich, Alex, is a PGY1 at Johns Hopkins in Baltimore. And Alex Wrights is sort of a PGY2, but she's in the middle of a couple of research years. So she is clinically a PGY2, but has been around for a while, longer than that, at Emory University in Atlanta. So we're going to ask you all, and thank you for very much. I know you all are extremely busy. Not that our faculty aren't busy, but you're the ones who are pulling call and doing all that kind of stuff. So what would you recommend the students do before internship starts? They've got these 2 months here. Besides filling out forms for the residency program coordinator and getting their, their licenses in order and all that stuff, what should they be doing? And I'll just, Alex writes, if you want to start, since I know you, I'm going to pick on you.
Sure. So to echo Dr. Troy, definitely plan a very epic vacation. I did not have a lot of money in my bank account, but I spent what remained, making sure I went and saw, the people that I didn't get to see as much in medical school and that I knew I was going to miss during residency. So certainly do that. My next recommendation would be, don't make your vacation so long that you don't spend time getting used to where you're going. So if you're moving, definitely give yourself enough time to settle in, find where the grocery store is, get your bearings, and then certainly meet with your co-residents and try and do some social bonding before you guys start. I think that's really critical, and there's a chunk of time that's available that you won't get back. Once you guys all hit the wards, it's going to be really busy and really tough, and you're going to want to get to know them, and it'll be too hard at that point. So those are my top recommendations.
Okay. Alex, the other Alex.
Sure, I'll chime in. It's along the same veins as vacation, but really spend time, identify the people who are really important to you, family, and close friends, and spend time with them while you have this kind of flexibility. Because when you're going into residency, you don't have that flexibility anymore, especially if you're going to a new place. Your support network isn't there, and you don't. You're constrained in that sense by your job. And during fourth year medical school, you have a lot of time, and I think focusing on thanking those people who have supported you, et cetera, and spending time will really energize you for the year that's coming and your career that you're embarking on.
Okay, Zaina, you want to say anything about that? Any tips things you think they should take care of?
Definitely. I think, to echo what everyone is saying, you're about to go through an extremely large transition from being a med student to being a resident, and you're going through a lot of changes even in your personal life, moving to a different place or even moving to a new home. So just mentally preparing yourself for that change in whatever way suits you best is going to be something that I think everyone would recommend. Whether that's vacation, whether that's spending time with your family, whether that's moving in early to your new place and just getting familiar with your new home. All of that is going to be what you want to do in those few months where you have absolutely no responsibilities. That prime time between like April to July when you get started, you'll never get that back. And once you get started in residency, it's just go, go, go. At most programs, you have 1 or 2 weeks off for vacation at max at a time. And so that long stretch of time to really be introspective and figure out what's important to you, what you want to be prioritizing when residency comes, outside of residency and in residency, what your goals are, kind of setting all of those expectations for yourself. It's a really good time for reflection and a really good time to prepare yourself for that big transition that's coming in your life.
Okay. How do you organize your life outside of internship to make it easier with no time? To make it easier to, say, have a social life? Or how do you do that? How do you find time for wellness and social life and, anything outside of residency?
I can start with this one. I think wellness looks different for different people, and organizing your life can also look differently for different people. It can mean a lot of structure. It could just mean kind of getting by with doing all the things that you need to get done outside of residency. I think my biggest advice, or two biggest pieces of advice, one is don't get behind on like the things that make you an adult and a human outside of the hospital. Just like the normal day-to-day things like paying your bills, getting your taxes done, getting groceries. Find a system that works for that. For some people, it's grocery deliveries and grocery pickups. For some people, it's actually going to the grocery store to get things and pick up what you need. And for some people, it's automatic billing, and some people have more specific ways that they want to do things. But find your system that works to getting your life things done so that they don't get overwhelming and behind when you have a busy week or a busy month on a very specific rotation. And the other thing is lean on your support system. Find that support system early. I think someone was saying, identify the people who are going to be really helpful to you in your new life, in your new residency programs, and figure out ways that you can seek help when you need it. It's always good to ask for help when things are busy and things are tough, and knowing who you can reach out to is going to be important.
Anybody else want to say anything about that? Okay, yeah. How do you get yourself organized as an intern at work? Any tips about things you should be doing to organize yourself? Things that you found helpful?
I'll start off with, I think I had, no system in place day one when I started. So I don't think that, it's unreasonable for you to walk in and sort of figure out what you're doing from the start. You've obviously followed patients, the things that you need to, be looking out for and preparing a list. The difference will be that it's just going to be the volume, right? As a student, you probably followed a handful of patients, and all of a sudden you're going to have a full service that you're, the main person for. So you're going to start off coming into the hospital at some terrible hour, because you're just going to be slow, and know that it will get easier. I think, for me, I definitely remember July being the toughest month. I just, put in some hard hours, and really, your first 24-hour call, all of those things will take a toll on you. But I think, like Xana said, use the people around you. Everyone has been there. Your programs have trained residents for a long time. Everyone knows what you're going through. And ask your senior residents what they did. How did they use their, systems to be organized? Everyone does something a little bit differently, and you're going to have to figure out what works for you. And for every person, that's unique. But, build on, you've already done successful building blocks as an M4, just take that next step as an intern.
Alex?
Yeah. I was gonna say, I really resonate with that last point about, asking your seniors, PGY2s that have been around the block now for a year. The other piece that I would add to that is be proactive about what's not working. We're especially like, July being the first month, you're overwhelmed by everything, but you should still take some time to introspectively figure out, okay, what worked today, what didn't work today, and the things that you felt like weren't going very well, weren't efficient. Talk to your fellow interns, co-interns, your co-residents who've been around the block, and work on those things. And I think you'll find that, I think someone mentioned that first 6 months, that within that first 6 months, you'll really start to really build that routine, and things will start getting easier if you address those issues or what you might feel are inadequacies early.
Yeah, I think similar to what everyone else is saying, seeking advice is my number one recommendation, especially on your first rotation. Talking to seniors who have done that rotation, or especially twos who have just finished that rotation potentially, they can give you some great advice on getting your feet wet at the beginning. And after that, it's really about finding what works for you. I think the biggest recommendation I can give is to try and be systematic, or find a system that works for you on your daily activities, like chart checking in the morning, and then when you're admitting patients and putting in those orders, figure out like what are the 5 or 6 steps that you need to do with each of those things, and what works best for you, and try to repeat that on the daily so that it becomes more familiar and it doesn't seem as overwhelming. Because like Alex mentioned, that first day you're going to show up really early because your efficiency is not where you want it to be. But slowly, as you create systems and figure out what works best for you, you'll become more efficient and you'll be able to spend more time improving your system and going from there. The other thing, these are more practical tips that I'm a very big tech person and I love technology. So get familiar with the apps that are available to you as far as like your EMR. If you have Cerner and your program provides you with like the power chart apps and the dictation apps, get super familiar with those because they can be extremely helpful to being efficient, especially dictating and all of that. And then also creating templates. Those are big things that if you can start early and get those things done early, especially in maybe like the first few weeks of your intern year, creating those templates that are going to make you efficient long-term is super helpful. And I think those are two things that practically a lot of people forget to mention because everyone just kind of has been doing them for so long. But if you can get started on them early, it's definitely a big help.
Okay. Were there things that surprised you when you first became an intern? Things that I remember in one of our conversations that we had with our students, somebody saying you have to find the printer. You have to know where the printer is. Were there things that you weren't expecting and kind of surprised you when you became an intern that you had to know, like making templates in your EMR? No, nobody was surprised.
I will confess, I really didn't know doses at like it in any way. I just felt like I knew medications, but dosage, what was a reasonable, first dose to give if someone needed a second dose of something, the timeline, all of those things, I felt wildly unprepared for. And I'll just say that, you learn these things like with time. You become familiar. You really only prescribe like a certain number of medications. You obviously become familiar with what patients' medication lists like have, so those numbers eventually stick in your head. But I remember being like very struck. I had a patient that was nauseous and I just had no idea what amount of Zofran to give. I'm sure none of you are like that. You're all much better prepared.
Okay.
Your first day of intern year, you like forget what the dosage is for Tylenol even. So it's definitely real. The other thing that I think surprised me as well, being an intern and just kind of stepping foot into such a large role after being a medical student. As a medical student, you obviously are as helpful as you can be, but there's not a lot of responsibility that falls on you. But then all of a sudden you're jumping into immediately putting orders in for patients and immediately having to manage like a third of a service or whatever it may be, however you split it up. And that sense of responsibility kind of dawns on you pretty quickly. So being able to take a step back and realize that you are prepared for this and you have a lot of people who are in your corner to help you. I think one of the biggest pieces of advice that I got when I started is load the boat early. So if you're ever in a situation where you're taking care of a patient and you feel like you're a little bit out of your comfort zone, immediately call people who can help. Your seniors, your attendings, additional nursing staff, whatever it is that you feel like, if you're in a situation where maybe you're not in the most comfortable place or you don't feel like you can handle it all, definitely call people early and load your boat. I think that's always helpful.
All right. How did you find a social life?
I can take the lead on this one. I think you're embarking on this journey, and you're not alone. And I think that's been a theme that a thread that a lot of people have mentioned. And I think I'll say specifically at Hopkins, we have the way that our schedule is structured, and this may or may not be the case for your program, but our program director specifically makes it so that most interns have their day off at the same day of the week, which is generally Saturday. And in that way, COVID has made it a little harder. But traditionally, the class really gets to know each other, and and you can bond over your shared experiences, and generally the classes get really close that way. So I've kind of built a social network within my group of co-interns in that way. And I think it's really important to be able to blow off steam and share your experiences with people who know what you're going through. So I'll put in a plug that way.
Okay. How do you find time to study and prepare for this app site? And if you could tell us, maybe tell the students that are watching, what are some of the resources you use? Were there any apps that were helpful or resources that were helpful for studying on the fly? Did you, were you very organized about your studying, or how did you do that? Or how do you do that?
I'll start with a description of my perhaps trial and error so you can learn from me. So I will confess, my intern year, I really struggled to study outside of taking care of patients. I think a great habit to have is to write down questions you have on your sheet that, is with all your boxes and all of that. And look those up at the end of the day. I think that was a way that I was able to constantly, be learning on the fly, on the job. And, if I caught a minute with my phone, just pulling up, the answers to whatever clinical questions popped in my head. I will say I had much better success. I went back to my med school roots. Dr. Pettit always said on your surgery rotation, just do 5 review questions a day. And that actually was very beneficial for me at that time. And I lost it my intern year, but I was able to get it back, and I did have a lot more success. So, my comparison of my intern cramming to, doing 5 questions a day, it's so feasible. There's a really big difference for me. And I did feel like I am more knowledgeable from doing those 5 questions a day. So I certainly recommend setting a low benchmark for yourself. And then, if you find yourself reading on top of that and doing other things regularly, that's great. But, set a reasonable goal. I think you're more likely to achieve that if you set one that you actually can do, because it will be very tough.
I completely agree with Alex. I think one of the biggest things that I learned this year is you're going to step into a realm where there's a lot of knowledge for you to gain, and it's going to be overwhelming, the sense of just how much you have still to learn. And always remind yourself that's why it's a 5-year program. But I think taking it one step at a time and biting off little chunks is so important. So every day, if you can just learn or teach yourself a couple new things, take that as a win, because your hours are crazy and you are essentially starting almost a new job every time you start a new rotation. And so you have to relearn how to kind of step onto your 2 feet when you start a new rotation every single month or every 6 weeks, whatever it is at your program. And so being able to just kind of decide, okay, this is my tidbit of knowledge that I gained today, and I'm okay with that just being it for the day, is important. And then also, as Alex mentioned, like once you get into the stride of things and you feel like you can have a little bit more time to study, take it small, start with a few questions, and then eventually you'll be able to get to the point where you're reading maybe an hour or 2 in a week from a book. A few resources that I've found really helpful are the Behind the Knife podcast. It's nice to have if you're driving places, if you go on a road trip, if you just have a long drive to a rotation, whatever it may be. Behind the Knife is something you can quickly and efficiently use to get like a 15-20 minute lecture in. A lot of the question apps that we have can be either an app or like a homepage. So like Surgical or like Score doesn't have an app per se, but you can add it to your homepage. Then you can just click on it, log in, and then answer questions or look things up. TrueLearn, which is a question bank for everyone, is a great thing that you can have on your phone to ask questions or answer questions. So there's a lot of different resources that you can have that are quickly on your phone for you to be able to have kind of filler questions throughout your day.
Okay.
And then Yeah, I'll just add to synthesize in another way. What Zaina just said is, I think it's important to have different modalities of learning. So reading, I think, is important. Picking a book. Behind the Knife has a great app site book, but the traditional one that I think at least a lot of people at Hopkins use is the Pfizer book, which is, quick bullet points of, what you need to know. Honestly, it's hard to do this, and I didn't do it, but if you can pick up that Pfizer book and memorize everything in there, there's not a question you're going to miss. That's very hard. It's a dense little booklet, but it's a great resource. So reading is important. Listening, use all your senses. Listening to podcasts like Behind the Knife again, super important. It's another way to be interactive while you're washing dishes, driving, etc. And then watching videos. And I don't know that I have a specific resource for that in particular, but some of the resources used in medical school, I'm sure, still are pertinent for the app site. Watching videos on certain topics or certain subjects that you struggle with, I think is really important. So just engage all your senses, and I think that's the way you'll really make things stick.
Yeah. Check, I will just throw this in. Check with the medical school that if your program is affiliated with a medical school, check with the medical school and see what they have as part of their library. They may have things like Access Surgery, which has a video library attached to it and has a lot of textbooks in different specialties that are for free. So check with your fellow interns and residents and see if the medical school has things online in their library that are available to you. So any other useful apps that you've found for either living or being an intern or studying, or ways of doing things, efficient ways of getting things done?
I would recommend making it your second brain. And I just mean, so for example, I put all the codes for the doors on a note on my phone, because you'll go to the supply closet on 7E and you'll be rushing around and you won't have the code, and somehow all the nurses are in rooms and there's no one around. So once you have a code, I just put it in, I organize it by hospital, and it just makes my life moving about the hospital easier. So I think little systemized things like that, making a template for each rotation. You'll probably go back to that rotation at some point and write another note, even as an upper level. It's very helpful to have those things built in. And I would recommend, because you're busy, you're going to be forgetful, and you're going to, forget that you needed to send, file your taxes or things like that. So having a system where if something pops in your mind, you put it in whatever note system you're using, and that you check that on a daily basis, but that way you can then forget about it and not worry about it. Perhaps as a sleep deprived mother, this is also my another pro tip.
How about you, Zaina?
I was going to say, I have to agree. My phone is literally my second brain, and I think I put almost everything in it. You'll start to hoard phone numbers for people and resources, and you're just going to start saving them obsessively in your phone. Anytime you get a phone number for a specialist or a consultant, you're going to want to save it right away. So that's not even an app. That's just a basic phone function. You're going to really rely on it. And obviously things like if you're an iPhone user, like Reminders app, or just whatever resource you use to keep yourself organized, a Google Calendar, whatever it may be, just to kind of check off those things that you have to do on the daily. We keep mentioning taxes. So if you guys haven't filed your taxes yet, definitely do it. And then the other couple things that I found super useful on my phone as far as apps are the ACGME case log app. And then for me, we have a hours logging system called New Innovation. So I have the app for that as well. I think case logging and logging your hours is something that kind of tends to fall between the cracks if you let it. And so keeping an app on your phone to just quickly log your hours at the end of the day or at the end of the week, whatever works best for you. And similarly with your case logs, being able to just jump on your phone after a case and quickly log it. Those things are really helpful. They both, for me, at least the New Innovations app for my hours logging, and then the ACGME app, they do take a little bit of time to get comfortable with. So try and familiarize yourself with like the favorites features for the case logs and all of that early on. But once you get familiar with them, it makes it really easy to log quick like appies or soft tissue cases that you're going to be doing in your intern year, which is awesome.
Okay.
I have also three apps actually that I would recommend specifically, and I'll make it very quick. One is usually there's your EMR may have an app associated with it. For instance, Epic, the one that we use here at Hopkins, there's a little app and you can toggle reminders on it so you can be the first to know when a lab results, etc., which is always a good look for an intern and well appreciated by your team. So that's one. The second is something called MedCalc or MDCalc. It's one you can find on the computer as well. You can type it into Google, but say for instance, your chief asks you to get urine lights on your patient to check a FENA, and you're like, oh gosh, what's a FENA again? You can type in FENA into this app, and then it'll tell you how to calculate it. You put in the actual whatever the sodium, et cetera, comes back as, and then there's a little explanation for how you use it, et cetera, and why you use it in what context. And so that's a great app too. The third app is, generally there are certain guidelines on like antibiotics to use in what cases, and in surgery you're always using antibiotics. Someone's always got an abscess or an infection, etc. If it's a vascular patient in the foot, it's different antibiotics than if it's an intra-abdominal abscess post-op day 4 from a Whipple or something. There will usually be guidelines for your specific institution that you can find. And at Hopkins, there's an app, an antibiotic app that can be very helpful when deciding what antibiotics to use.
Okay, good. How do you deal with medical students and teaching medical students? How do you all do that?
I think this is definitely a hard one the first few months of your intern year, because you were just a medical student and now you're an intern, and you're trying to juggle the responsibilities that you have while also trying to teach and help someone else who's really trying to learn and be engaged. And so I definitely struggled with it my first few months, because I had always known I wanted to work with medical students in the future and that medical education is important to me. And I think the things that ended up working well is setting expectations early. I think Dr. Petit mentioned that, or someone had mentioned that in the program director panel, is setting expectations is really helpful for both you and them. It can feel a little strange at the beginning being the person to say, hey, this is what I expect from you, this is what I want you to do. But it makes it easier because then you both have clarity. You know that as the resident, you've told them what you want them to do. And so you can hope that they're going to do their best to achieve those things. And then they know what they need to do. They have kind of a sense of direction. So that's really helpful to them early on. The second thing I think is giving them little tasks on the day-to-day basis. Sometimes it's hard for medical students to realize how they can be helpful, even though they really want to be. And so giving them small tasks every day for their patients, or even patients for the entire team, can be helpful. And then lastly, and this is kind of one of my cheats for studying as well, is give them something to read and then have them come back to you on it. And that way they're learning and they're kind of diving into reading articles or whatever it might be, and they can bring back that information and almost not teach and remind you of what you've forgotten. We don't have as much time to look up like primary articles and stuff like that. And so they have a little bit more time to do that, and they can come back and teach it to you, and they'll feel gratified by doing it. And then you'll get to review some things that you might not otherwise have been able to look up. So I think those would be my 3 big tips that I've kind of cultivated over the year of struggling with that issue.
And I'll chime in and say, first of all, apologize, I turned on my camera. I'm still in the hospital and on the move, but I'm still listening and interacting. My big piece of advice is that, it can be overwhelming when you think that, you have to teach these people who are like maybe even just 1 year behind you, you know, everything all encompassing, how to be a master surgeon. I mean, you're none of those things yet. And hopefully you will be. But you can teach them the little things, you know, especially if it's a sub-I, you know, the little tricks that you learned, you know, in the first 6 months about, you know, how to stay organized or how to tie knots. You know, we always can learn how to tie knots better. And I find that that's a useful thing to do. For instance, you know, while you're waiting for a high pec to start, you know, let's tie some knots to a post and get our technique down. So, you know, they can be really simple things. And I think that, you know, those are things that I appreciated as a medical student from, you know, the interns above me. So it doesn't have to be huge things. Little things are really useful too.
Yeah, I think my only tip to add is I think it's reasonable as an intern to just have like 2 cases that you kind of have down that you can take med students through, because the med students change every month. Your cases don't have to. So I would always take my students through a trauma case, and then yeah, they certainly would ask me questions that I did not have the answer for, but you know, then I would say, okay, like someone go look that up. Let's find, you know, let's find out. Like I forgot, you know, what's the amount of, if the chest tube's putting out over 6 hours, you know, when we need to go back. And so I think, you know, being interactive, and then also as the intern, you know, really being the person that the med students can ask anything of, and just like letting them know that. So when you set those expectations, it might feel weird, but the way you can soften that blow is just say, hey, I'm the person on the team. You can ask me anything. Like, you don't have to, you know, you can be smart and, you know, interesting to the attending and the chief. And for me, you can ask me where the bathroom is. Like, and I think that's just a way that, you know, you can make your team work better and have people be comfortable.
Okay.
Kind of supplement that last point. I think my interns used to do this for me when I was a med student, and I like to pass it along, is helping the med student look good also makes you look good. And so having them or helping them and answering questions you think that they're going to get asked by the seniors or by the attendings is always super helpful. So I always let them know, like, hey, this is something that the attending might ask you in this case, or these are the common PIMP questions in this OR, this is what they might ask you about this patient presentation. And those are little things that can go a long way for the med student to be able to come back and ask you more questions in the future, and also makes them look good, which in turn makes you look good as an intern.
Yeah. Good. What do you do if you're having trouble with somebody on the team? Whether it's a chief or a senior resident, or how do you handle that? Or maybe you've never had trouble with anybody on a team.
You are undoubtedly going to run into issues as an intern or as a resident in the future. I think the number one thing to remember is that this is a professional environment, and these are colleagues that you're going to be working with for a very long time. So you definitely don't want to be burning any bridges. We are all adults, and we're all wanting to be part of a bigger team, hopefully. And so I think the biggest advice is to just reach out to that person and discuss what the issue is. And try to find a resolution between yourselves before escalating it any further, because most of the time these issues really arise from miscommunication, and just trying to figure out what happened and trying to achieve clarity can get you a long way.
Okay. Dr. Yang, you've been watching the Q&A. Do you want to answer, give us some questions from the students?
Yeah, it's great. Thank you all. Again, these are some wonderful advice. I think you hit up a lot of the topics that the audience has. Maybe getting back to a little bit about your personal life. A couple questions on how to raise a family, and particularly Alex writes. Well, Alex Schulich, maybe you want to answer this as well. I mean, how can you be a good mother? Being as an intern, I'll give my 2 cents worth. You know, I was very efficient. I had twins, so we had sort of an instant family very quickly. But talk about your personal life a bit.
Yes, so I did not have a child when I was an intern. I had one later in residency. But you know, I think it's possible. I would say almost 50% of our residents, you know, have a kid at some point, you know, during training. I know Dr. Pettit has a many children, impressively. So you know, I think you will have certain things that are just unachievable. I think one of the best ways you can do is really look critically at your life and how you spend your time. And so, you know, we only have 24 hours in a day, and you are probably going to spend a fair amount of them at work. So really think about what you want to do when you're not at work, and that might mean you know, you might not watch TV anymore. Like that's one thing. I basically don't watch TV, but as a result I feel like, you know, I'm able to spend time with my husband, spend time with my kids, sorry, I made it plural. And you know, I still exercise, not as often as I'd like, but you know, I'm able to fit in the things that I think I need to be happy with my quality of life. And it's always going to be tough, and residency will always be a struggle to have a balance. But it's certainly achievable, and really lean on people, you know, in your life. So if you're really at a breaking point, it's not a sign of weakness to ask for help. I think that's something that we really struggle with in surgery. And I look back at, you know, myself as an intern, and there's times where I wish I had asked for help, and I felt like I really, you know, tried to do things alone. And I think it's a sign of maturity, and being qualified to really know when you like need to lean on other people. So yeah, so best of luck, but it's all doable. And I, you know, learn from the other parents in your program. They've all got great tips. And you know, have your group chat, and you know, talk about the terrible things and the funny things and the wonderful things.
Dana?
I can't speak to being a mother, but I was going to say, as far as finding that support system, I think that's going to be critical in your first year. You're going to have a lot of ups and downs, and you're going to want to have people you can go to for different things. It might be hard for family or friends to relate to what you're going through on a daily basis as an intern. Some certain situations with patients that can be sad or hard or difficult for you to get through. And being able to reach out to your co-interns or your co-residents in those situations is so key. So I know Alex had mentioned earlier, between now and starting your intern year, reach out to your co-interns. They're going to be the people who are going to go through this journey with you. And though it's not going to be identical to your journey, it's going to be as close as possible. And so having your co-interns and co-residents to reach out to and be your support system for certain situations is really important. And I just wanted to stress that again.
There's a couple of questions about things that you should buy or have available. There's one question about what should we have besides comfortable shoes before we start? And there's another one about anything you recommend buying to make life in residency easier. So anything besides comfortable shoes?
That's an easy question for me. So what to bring on your first day is a good attitude, and bring that for the rest of the year, because it's tough. It's a challenging profession that you're getting started in, and there will be good days, there'll be bad days. But if you come in willing and excited to learn, and take care of your patients, you're gonna be better off for it. You're gonna learn more. People are gonna appreciate you, and you're just gonna have a better quality of life overall. So that's what you should bring. And then the thing that I would buy is, and this is a debated topic amongst my friend group, but I'm a strong believer in multicolored pens, very fine tip, 0.38, because you can write really small and make really tiny boxes in a way that, you know, the normal thin 0.5 you can't do. So that's my advice.
And with that, really good glasses then too, right?
Don't make fun of me, Dr. Yang.
Alex, I don't think that should be a debated topic at all. I'm all for the multicolored 0.3 or 0.5 pen. I was trying to look for mine, but I can't find it.
There might be a theme here. I was not a multicolored pen. So if you're out there and you're concerned, that's okay. I would say you're probably going to experiment with your shoes. I feel like everyone experiments with their shoes and are very into their shoes in surgery. And really, I think try and have your apartment or your house or wherever you're living well stocked. I think having that set up day one just really takes a lot off your plate. If you're trying to move in somewhere and still, you're starting, try and avoid that if possible. And always put a granola bar in your pocket.
A question about mentorship. Do you look toward your program director? Are you assigned a mentor, and how do you find mentors when you get there? Especially if you say you're interested in another subspecialty, how do you do that?
I think it's going to differ based off your program. At some programs, you get assigned a resident, like a senior resident mentor. Some programs have a faculty mentor assigned to you, and some programs have, for example, an ombudsman for the class. I think the biggest advice I can give is, first and foremost, thank the people who have gotten you this far. You probably have a support system that's gotten you to the point that you are today, and make sure you thank those people, because they'll definitely champion for you even as you progress into surgical residency. So cultivating the relationships you already have with mentors is definitely something that I would recommend you continue doing during your surgical residency. And then the second piece of advice is, don't be afraid to reach out to attendings and people at your institution. You have gotten this far for a reason, and everyone wants you to succeed in the end. And so if you have questions, or if you have a certain specialty that you are wanting to pursue, reach out to the person who you've worked with in that specialty and just say, hey, this is the future that I would like to see for myself. What advice do you have for me? I think those would be my two biggest advice.
And remember, folks, you can have more than one mentor. You can have a mentor for your personal life. You can have a faculty member that looks like they have it all together. If you find that person, by the way, let me know, because most of us would like to have that person as a mentor. But if you find a person that seems to have, the whole kid or whatever it is you're interested in thing together, you can have a mentor for that aspect of your life. You can have a mentor in a couple of specialties that you're interested in. You can have a mentor for how to be a better teacher. You can have mentors of all kinds. There isn't one mentor that was going to fulfill all the needs that you have in your life for professional development and personal development. So think very fluidly when you think about mentorship.
And then perhaps last question, sort of apropos for what everyone wants to be. You're going to be a surgeon. How do you prep for the operating room? And especially, say you're not really sure, you feel uncomfortable, or do you tell them you're scared? What if you just don't feel very comfortable about a procedure? What's some advice that you should give?
Yeah, I think better to be prepared than and a little bit late sometimes, I think, than totally unprepared. So when you're the intern, you're doing all your work on the floor, you're going to go check in the OR and you have your list. I do think it is important that what case is going on, who that patient is, what's the indication for their surgery, and the basic steps of that surgery. No one's asking that you be capable of performing a Whipple, right? They're only going to want you to have what's appropriate to your level. But I would recommend that. I use Zollinger's Atlas for preparation in terms of like specific cases. And I basically would always like prep the night before, look at what the team had on schedule, who are, knowing the patients. I think the strength as the intern is no one's going to expect that everything but you can really know the patients, and you can kind of, do a deeper chart dive and know a little bit about their history, and make sure that you're checking on them on the floor, multiple times a day, and that way you build rapport, and you really can give accurate information. So and then if you are uncomfortable with the procedure, absolutely speak up. It's doing anything the first time, I think, is really terrifying. The difference between the first time and the second time, it is very stunning. And it's okay to say, I think a great way, because you don't want your procedures taken from you, is to say, if you say you've done it once before, or say, I've never done this before, but I would like to do it, or I would like to start the case, or, give, if you can give explicit directives as to the steps you want to perform, people will help you perform those steps, and it will let you gain your education, I think. So don't do things you don't feel qualified for simply to gain. I think there's a way you can be a little more tactile about that.
At the same time, I would say, step up to the challenge, right? Like, it's okay to be nervous. It's okay to feel like you don't know what you're doing. Generally, you have a lot of supervision, a lot of eyes. Even if you feel like you don't have those eyes, someone's always watching, from the back of their head. So rise up to the challenge, and you'll find it's not as scary as you thought. And you'll learn a lot from it. So I would really encourage you to accept those challenges, accept that you don't know, and are willing to learn, on the battlefield.
All right, I think we are, yes, Kim has put up something from the college called Successfully Navigating the First Year. It's a small pamphlet of what the college thinks, experts in the college who know about such things, program directors, etc., about what you should know coming into internship, kind of a content as well as professionalism sorts of things. It's a small booklet. It's available to you through the college, and it's in the chat. And thank you very much, all of you, Zaina and Alex for being on the webinar tonight. I'm sure the students have been this has been really helpful to the students who are terrified and excited and, all of those things to become a surgical intern. And thank you very much for helping us out tonight. And thank you to our program directors, Dr. Quick and Dr. Lippman and Dr. Cho and Choi. And thank you, all of you, for, and also to the members of the committee for putting this together. So, and the members of the ACS staff. So have a good night, everybody.
Thank you, Dr. Petit, for having us.
Yes, thank you so much.
One last thing, please fill out the survey. And because we really need your feedback. So again, we thanked everybody. It was such a great webinar. I almost want to be an intern again. With all the stuff that I find on my phone. It's a lot easier than doing what I do right now. So
Steve, call me. We can make that happen.
Steve, your nose is growing.
Well, thank the ACS, Dr. Sachdeva, our director, Patrice Blair, who's the associate director, who I saw was on the call. And if you have any questions, please feel free to email the ACS. Brad Aiken is happy to field some questions for us. And good luck next year. We know we know our specialty is in great hands with you in our future. So take care. Have a great summer. And we'll see you on the wards.